Hello, and welcome to Public Health Matters, a monthly program dedicated to discussing public health issues in our community. This program is sponsored by the Middlebrook Regional Health Commission, which serves the towns of Bound Brook, Greenbrook, Middlesex, South Bound Brook, Warren, and Watchung. My name is Colleen McKay-Wharton, and I'm the health educator for the Commission and the host of this program. Our goal for Public Health Matters is to give you a program that will provide useful information to help you better understand important public health issues, and in particular what you can do to reduce any risks associated with them. September is National Preparedness Month, which is a nationwide effort held each year to encourage people to take simple steps to prepare for emergencies, be it in their homes, their businesses, or the schools. The goal of this month is to increase public awareness about the importance of preparing for these emergencies, and in particular to encourage individuals to take action today. Our guests will talk about two aspects of emergency preparedness. First, we'll speak with Jim Langenbach with the New Jersey Department of Health and Senior Services, and we'll learn about some of the systems that are in place to help the department better respond to a statewide emergency. And then we'll also be speaking with Executive Director of the Greater Somerset County Chapter of the American Red Cross, and that's Amy Sutton, who will highlight some of the simple ways we can all manage to better prepare for emergencies of any type. Thank you both for joining us so much today.
Thank you, Colleen.
Thank you. Jim, I think, although it's Emergency Preparedness Month, and this has been happening now for, I think, at least 3 years, I think most people don't think of public health agencies as being a part of that emergency responder world. Is that correct? Has that been your experience?
It is. That's a great, a great assumption.
Okay.
We haven't been. Public health has not been. We've always been considered as part of the group.
Okay.
Riding on the bus, if you will, of the preparedness. But not until like 1995, 96 that people realized that we actually had to, not only were we on the bus, but in some cases we were driving the bus. Matters like what we're talking about now, the pandemic influenza, SARS, bioterrorism, all those things. The response community looked to us, public health, as being now in a more leadership role than following.
Than in the past.
Right.
Now, and then certainly anthrax, I guess, in 2001, which really elevated public health in a very visible way.
That kind of cemented our part in emergency preparedness. When we started talking about anthrax in 2001, the actual anthrax and all the hoaxes that went along with it for those months and months cemented our role as a big player, a part of the emergency preparedness team.
Now, I think our viewers are very much aware at this point that there are local health departments and county health departments and a host of a very local presence for public health agencies. But as the state health agency, what are some of the things that you do on that larger level to help prepare communities and the state for emergencies that may occur?
I guess besides the guidance and the leadership part, I think one of our biggest things is we are the administrative agent for some grants, funding that comes through from the federal government, either for hospitals and healthcare facilities or for public health through the CDC cooperative agreements and grants come through. And it's a direct pass-through. It comes through to the state as the administrative agent, and we pass it through to the locals and county health departments to help them with their preparedness efforts.
Okay. So maybe we can look at the hospitals just briefly. The funding that comes through the state to help prepare hospitals, what sorts of things might they be doing to help be better prepared for a large-scale emergency?
Well, we all know, since 9/11 we went through the terrorism preparedness.
Okay.
Well, now we've shifted. We're still very much, aware of the threat, the terrorism threat, but we're looking more at all hazards now. So all hazards includes terrorism plus the natural disasters, hurricanes, floods, things like that. We just had an earthquake in New Jersey yesterday, a little 2.1 earthquake up in Milford.
I missed that completely.
But, things like that. So we're helping hospitals prepare for that.
Okay.
Again, through funding. If it's communications equipment, we had an initiative a couple of years ago where we provided decontamination trailers for them so they could decontaminate patients before they came into their emergency departments. And
in the event of the things like anthrax and so on. Okay.
So all those funding initiatives, that's one of the big things, plus the leadership and guidance.
Okay. Now, you also provide funding for public health agencies, sort of the more traditional local health departments, county-level health departments. But what sorts of activities, I guess, would they be doing with that sort of funding?
The same thing. Again, it's public outreach similar to what we're doing here today.
Okay.
Training, education, exercises are a big thing. We've
Okay.
realized, that it's enough to give people stuff and money to buy stuff, but now we want to have you actually use the stuff.
Right.
So we engage the public health and county health departments along with their hospitals in
Okay.
exercises.
Can you explain for us, I think while we're used to the term of exercises and drills and emergency management does that all the time, what does that really mean? How does that play out, and why would that be important for the general public to, because I think they're very important, and I think you're right, you can't just buy stuff. You have to know how to use the stuff.
Right.
But can you give us some examples on what that means?
Well, there's a whole a continuum. It's planning, training, and exercising.
Okay.
So first we do a needs assessment. We look at something, a situation like preparedness for SARS.
Okay.
We use SARS as an example.
Okay.
And there's a need to prepare for SARS and how would you prepare for SARS, and we develop a plan based on that.
Okay.
And then we train everyone that's involved in the plan to the plan.
Okay.
How does a public health agency respond to a SARS incident? How does a
Okay.
hospital respond to SARS patients presenting at their door?
Right, right.
And then we exercise that. So we put them
Okay.
through a test. An exercise is a test. It's an
Okay.
evaluation of the plan. And at the end of the exercise, we then have an after-action report and evaluate the exercise and how well people performed. And then we go back and tweak the plan again. So it's a
Okay.
continuing, it's not so much a cycle, it's more of a spiral because it's over time.
Okay.
Plan, train, exercise.
And then just improve it, and so
keep
that
going.
all of those who are involved with this know what they're supposed to do.
Right.
And that sounds like a very simple concept. But the fact is, we have not really been exposed to these sorts of things here in the U.S. and in New Jersey. We didn't really experience SARS
Right.
to any great extent. We certainly, but prior to that, those sorts of large communicable disease concerns hadn't really shown themselves in quite some time.
But some of the
Right.
things we have experienced, the flooding,
Right, exactly.
the Floyd flooding and things like that, the natural disasters, we have had a ton of experience in those things.
That's exactly
So
right.
that's what again, when we go back to the all hazards approach, we're looking to prepare for those things.
Right,
And
right,
help,
right.
help everybody prepare for them.
Now, I know the state is also very much involved with getting community members involved with these sorts of activities and teaching them to play a role in such an event. Can you talk a little bit about what that's about?
Well, and that's a great question, Colleen. Thank you, because I'm a salesperson for the Medical Reserve Corps.
Okay.
It's one of my other functions.
All right. Tell us what that's about,
again,
the Medical Reserve
we
Corps.
set up these systems, and the systems start at the state level, and then they go down to the county and the local level.
Okay.
And one of the systems is a Medical Reserve Corps, and it's just a corps of dedicated volunteers, trained volunteers, that can come out and assist their community in time of need.
Okay.
Now, there's always been the Citizen Corps program, which is, Medical Reserve Corps, CERT teams, the Community Emergency Response teams.
Mm-hmm.
We join that, and Medical Reserve Corps is a piece of that now. And we
Okay.
encourage people, medical professionals, retired nurses and docs,
Okay.
and public health people that want to get involved in their community to come out and join these things. And they're county-based.
Okay.
They can be mobilized in time of need. We mobilized the MRC during Katrina. We sent MRC volunteers down to Louisiana
Okay.
from New Jersey.
Now, you mentioned the community emergency response. So you have the Medical Reserve Corps, which predominantly are more healthcare providers,
Correct.
retired folks, but then there's the CERT teams, and that's a slightly different angle?
It's
Or slightly
more,
different
again,
response?
it's people helping people, neighbors helping neighbors.
Okay.
So it could be electricians, it could be any kind of carpenters, any kind of a workforce that could come out there and help their neighbors in time of need. Again, it's always been the mantra that we preach in emergency preparedness is that we're going to be by ourselves for 72 hours before the federal government comes in to help us.
Right.
And it was demonstrated in Katrina, it's been demonstrated over and over again. So we're preparing at the state level and down at the local level to take care of ourselves.
Jim, that is really the perfect segue. So you have this state infrastructure that's getting in place to do as much as it can. We have the Medical Reserve Corps and the local public health agencies and the CERT teams to help at that